Hey there viewers! Gallstones can be very painful, and the sad part is their symptoms are often masked by nausea, acidity, and indigestion. So you're left blaming your meals for these problems instead of tackling the real issue. In today's video, we'll talk about gallstones and what you need to know. What causes them? What are their symptoms? How do you develop gallstones? Is too much cholesterol in your diet responsible for this? What's the treatment for gallstones? Does dark-colored urine indicate the presence of stones in your gallbladder? What about weirdly colored stools? We'll be discussing all of these and more. What are gallstones? What causes them? Some people think the gallbladder is the place where bile juice is made. Well, not quite. Your gallbladder is where the bile juice is stored. It's made by the liver and meant to break down and digest food. If your liver is producing more cholesterol than your bile can process, gallstones are formed. About 80% of gallstones are made up of cholesterol. The remaining 20% contain bilirubin and calcium salts. When your liver destroys the older red blood cells, bilirubin is produced. If your body is facing liver issues or any blood disorders, your liver may produce more than the required amount of bilirubin. This results in gallstones. Another reason why gallstones occur is because your gallbladder doesn't empty completely. In short, there's still bile juice left in the gallbladder on a regular basis. When your gallbladder isn't empty, your bile gets concentrated more than normal. This leads to the formation of gallstones. Do you eat a balanced diet? How do you manage your cholesterol levels? Share your experiences with the Bestie community in the comments below. Gallstone symptoms. The best indicator of gallstones is the pain in your upper right abdomen. If your pain only lasts a couple hours, it's probably due to fried foods. But if it lasts longer, then it could be a symptom of gallstones. Other symptoms that indicate gallstones include nausea, vomiting, diarrhea, and indigestion. Is your urine a dark color? Are you experiencing clay-colored stools? These could also be gallstone symptoms. There's one thing about gallbladder stones that makes them even more dangerous. It's their ability to remain asymptomatic. You could have gallstones and not even know it. This is because the typical pain you experience in your abdomen is not due to the gallstones themselves. It's actually because these stones are blocking the bile from flowing out of the gallbladder. In fact, it's estimated that about 80% of people have these asymptomatic gallstones. So you could have gallstones right now and not even know about it. If this is the case, it's usually an X-ray for an unrelated issue that reveals them. Gallstone Prevention, foods to avoid. There are certain things you can do to reduce your risk of gallstones. They can all reduce the pain. First and foremost, you need to avoid eating high-fat, greasy fried foods. When you already have extra cholesterol turning into gallstones, you certainly don't want to eat more garbage. Choose low-fat foods whenever you can. Eating foods rich in fiber will help your bowel movements. This will reduce the risk of gallstone formation. Solid poop reduces the chances of bile staying in your gallbladder. But try not to eat too much fiber, as it can also produce gas in your body. You should also try to stay away from foods and drinks that cause diarrhea. These include dairy products and caffeinated beverages. Another thing you can do to reduce your chances of gallstones is eating smaller meals. When you eat smaller portions several times a day, it makes it easier for your digestive system to process the food. Drinking 6 to 8 glasses of water a day is also essential. Before we move ahead, here's another video you might like. You know, your kidneys can also form stones. Watch and learn more about 7 ways you're hurting your kidneys. Gallstone Diagnosis. Your doctor will do a preliminary examination by checking your eyes and skin for any alteration in color. If there's a tint of yellow, it could be due to jaundice, which is caused by a higher amount of bilirubin in your body. Beyond a physical exam, your doctor might do a diagnostic test for confirmation. A CT scan will take pictures of your abdomen region, as well as the liver, which your doctor will check for gallstones. However, an ultrasound is the most preferred diagnostic tool to check for gallstones. The images it gives of your abdomen can also be used to check for acute cholecystitis. Now, what is cholecystitis? It's inflammation of the gallbladder, which can lead to serious, sometimes life-threatening complications, such as gallbladder rupture. Symptoms of cholecystitis include severe pain or discomfort in your abdomen, shoulders, and back. Nausea, vomiting, and fever are among other symptoms. The biggest risk factor for this disease is the presence of gallstones. They can even lead to infection within the gallbladder, damage to gallbladder tissues, and perforation. Tears in your gallbladder can have serious complications. Your doctor may choose to go for more elaborate gallbladder scans. It takes 1 hour to complete this particular test. For the scan, you'll be injected with a radioactive substance in your veins, which travels to your liver and gallbladder through the bloodstream. A scan will then show if there's any infection or if the bile duct has been blocked by gallstones. Endoscopy is another tool available to check for gallstones. The procedure involves using a camera and X-ray to see if there are any problems in the bile or pancreatic ducts. If bilirubin is the tissue, your doctor may choose to do some blood tests. These tests can show how much bilirubin is present in your blood. If it's on the higher side, then gallstones could be an issue. These blood tests can also tell whether your liver is working. Treatment. Number 1. Home remedies. If you have asymptomatic gallstones, a few changes in your lifestyle can help get rid of them. Of course, they will need to be diagnosed first. How else are you going to know you have them? Nutritional supplements such as vitamin C, iron, and lecithin can help avoid gallstones. So, what are the vitamin C-rich foods you can eat on a daily basis? How about you start with strawberries? They're delicious and filled with vitamin C. Lemon and oranges are well-known vitamin C foods. You can also include broccoli and peppers in your daily diet. Brussels sprouts and potatoes are great options too. Gallbladder flush is recommended for those who already have gallstones. With this, you'll fast first, followed by lemon juice and olive oil. Doing this is expected to help you pass gallstones. Number 2. Surgery. You might have to go for gallbladder removal. This procedure is quite common, and you can even go home on the day of the surgery if there are no complications. You'll first be given general anesthesia. 3 to 4 incisions will be made in your abdomen, where a device will be inserted to remove your gallbladder. If you're wondering what will happen to the bile you ingest, it will reroute from the liver to the small intestine. Since it's no longer stored in the gallbladder, the bile will be less concentrated. This could result in watery stools and diarrhea. Eating less fatty food should resolve this issue. Number 3. Non-surgical treatments. With advancements in technology, medication is no longer suggested for treating gallstones. Surgery has become a lot less of a risk. As a result, it's now the preferred treatment method. If you can't go for surgery, your doctor might prescribe you specific medications to treat the issue. You need to take them 2 to 4 times a day. They'll work by dissolving the gallstones using cholesterol. But keep in mind, this is a long process that may take years. Another non-surgical option is shockwave lithotripsy. In this, a machine called a lithotripter is used to send shockwaves through the body. These shockwaves can break the gallstones into smaller pieces, making it easier for them to pass through the gallbladder. Just like gallstones, you can also get urinary stones. Your kidneys will develop them if you're not careful. Do you know how to spot kidney issues in time, or foods you want to avoid if you want your kidneys to remain healthy? Here are a couple of videos you should watch. Check out 12 signs your kidneys need help, or how about 9 foods destroying your unhealthy kidneys? Go ahead, click one, or better yet, watch both, and learn more about how to keep your gallbladder happy. Do you think you might have gallstones? Let us know in the comments below.